Now, let me introduce my boss, my mentor, and my friend in Ethiopia. His Excellency, Dr. Kesete-birhan Admasu, is the Minister of Health of the Federal Democratic Republic of Ethiopia. Prior to his appointment as minister in November 2012, Dr. Kesete served as State Minister of Health, the Program Sector, and Director General of Health Promotion and Disease Prevention. In his capacities as State Minister and Director General, Dr. Kesete oversaw the health sector reform program and led the implementation of the country's flagship program, the Health Extension Program, which significantly expanded the coverage of public health services in Ethiopia. Dr. Kesete has been spearheading the establishment of a health development army of over 3 million to ensure the massive social mobilization for healthcare services through participatory learning and action approaches. The Health Development Army is regarded as the key vehicle that will help Ethiopia achieve its ambitious 5-year health sector development program targets and Millennium Development Goals. Dr. Kesete has championed a number of innovative approaches in delivering maternal and child health care services, task shifting, and implementation of a large-scale healthcare intervention, such as the rollout of the integrated community case management of childhood illnesses and insertion of the single rod implant through the Health Extension Platform. While Chief Executive Officer of the largest public psychiatric facility in Ethiopia, Dr. Kesete's leadership in transforming how psychiatric services are delivered has become a model for scaling up the delivery of mental health care in the world. Dr. Kesete has also been nominated as an outstanding 2013 Harvard Health Leader, part of the ministerial leadership in health program at Harvard University. I'm not sure where Harvard is. I'm just kidding. As a medical director by training with a master's in public health, Dr. Kesete has dedicated his entire career to public service and scientific research focused on major health problems in Ethiopia. It is my honor to introduce, as you will agree with me, one of the most humble, soft-spoken, approachable global leader in public health with the most endearing smile, too, to add. Dr. Kesete-birhan Admasu, the young and dynamic Minister of Health of the Federal Republic of Ethiopia.
Thank you, Oing, for your kind words. Don't listen to him. He's my friend. He always speaks, good things about me. Your Excellency, Prime Minister Haile Mariam Desalegn, Your Excellency, First Lady Wezero Roman Tesfaye, Your Excellency, Dr. Dlamini Zuma, Chairperson of the AU Commission, my friend, UNFPA Executive Director, Dr. Baba Dunde, another friend from Bill and Melinda Gates Foundation, Dr. Chris, honorable ministers, distinguished members of parliament, distinguished representatives of development partners, excellencies, ladies and gentlemen. It gives me great pleasure to speak today on the opening of the third International Conference on Family Planning. I would like to thank you all for accepting our invitation and being here with us today. Honorable Prime Minister, Excellencies, ladies and gentlemen, back in June 2011, Ethiopia accepted to host the third International Conference on Family Planning in Addis. After going through all the hard work and preparation that took about a year, the conference has now become a reality, thanks to the tireless effort and collaboration between the national and international organizing bodies. This International Conference on Family Planning aims at examining cutting-edge programs and research that are helping to advance the health and wealth of families and nations worldwide. This conference is a platform to advance family planning policies, share best practices and new innovations, and recommit ourselves to make family planning a decisive development agenda across the globe. Most of all, this third international conference is a moment for all of us to appreciate the hard work and celebrate our success. As you know, during and shortly after the June 2011 historic London summit, countries signed the pledge committing themselves to reach millions of women with family planning and reproductive health services. Together, they stood up and declared that all women must have access to family planning services. A year and a half into our Family Planning 2020 commitment, countries have now the opportunity to present some case studies and success stories to show how they have improved access to family planning and reproductive health services, and I believe every country has best practices to share. Excellencies, ladies and gentlemen, exactly a year ago, more than 500 participants comprised of policymakers, parliamentarians, development partners, academia, researchers, and youth participated in our first ever National Family Planning Symposium and declared that family planning is not only a priority for the health sector in Ethiopia, but a national development agenda. On our national symposium, we called upon all stakeholders to accelerate the momentum, empower youth and women, and increase investment on family planning programs. We jointly committed ourselves to reach 11.2 million women in Ethiopia by 2020 to benefit from family planning programs in accordance with the pledge made at the London summit. Ethiopia has dramatically improved access to modern family planning services and registered notable achievements in the effort to improve access to family planning services. As you have seen from the video, our contraceptive prevalence rate has increased by nearly fivefold in the years 2000 to 2011. These achievements were possible because of the high political commitment, strong leadership of the health sector, and unprecedented global support by our development partners. At the center of all the successes in the health sector are the right policies, strategies, and programs that are put by our government. The role of our flagship program, the Health Extension Program, which embraces more than 38,000 government salaried health extension workers, has been pivotal in the achievement of remarkable results such as increase in contraceptive prevalence rate, the achievement of MDGs 4 and 6, well ahead of the deadline 2015. To consolidate the gains we have made so far and foster community ownership, we are currently implementing an organized movement of the community, particularly women, through participatory learning and action meetings, which we refer as the Women-Centered Health Development Army. The Health Development Army is an effective tool to massively mobilize the community and address cultural, attitudinal, and social bottlenecks that hinder uptake of critical services. Through this homegrown initiative, we are trying to mobilize around 3 million women volunteer leaders to work alongside with our health extension workers and bring social transformation in each community in Ethiopia. Despite all the achievements and progresses we have made, there are still a lot to do, and there are more women to be reached. We have to reduce the unmet need for family planning and reach an additional 6.7 million women in Ethiopia who want to avoid pregnancy but are not using family planning. And most of all, we need to join hands and meet the huge financial gap to ensure contraceptive commodity security. Excellencies, ladies and gentlemen, Ethiopia has demonstrated that with country ownership, sustained political commitment and effective strategies, there is hope for dramatically improving access to voluntary family planning services and reduce the unmet need. During the Dakar conference 2 years ago, I had the privilege of giving a closing remark, and I talked about 4 important issues. Allow me to repeat the most important element, which is country ownership. Country ownership is the surest way for developing countries to chart their own courses of development and overcome the challenge they face in building effective and productive states. Ownership reinforces commitment, and commitment in turn yields results and assures long-term sustainability. In Ethiopia, we couldn't have achieved such encouraging progress in our health sector without this type of genuine ownership and the space to pursue an approach to service delivery on the basis of health system strengthening. The principles and actions that need to be taken toward this country ownership are neither new nor particularly difficult to understand. Countries simply must be on the driving seat for the effect of development aid to be maximized, with no backseat drivers, of course. What seems to be missing is partners' full commitment to country ownership. Partners have a wide range of interests that hinder them from fully embracing country-led processes. But a decisive shift has to happen now if the MDG targets are to be reached. We urge all development partners to move forward in a new spirit of candor and partnership to make country ownership a reality. That way, achieving the MDGs and our Family Planning 2020 goals will become a reality too. Excellencies, ladies and gentlemen, I finally call upon all the countries to honor your pledge with firm local commitment, national plans and budgets, but most importantly, with action. We have had similar conferences in the past. Now is the time to walk our talk. Let's join hands to make the world a better place for women, children, and youth. We can translate women's rights to women realities. It is my strong belief that this conference will enrich the experiences we have at the ground and will assist countries and all stakeholders in their endeavor to improving access to and broadening choices on family planning services. I wish you a successful conference and an enjoyable stay in Addis. Thank you very much.